Hi, my name is Kelsey. I'm a physical therapy student at Campbell University, and today we're going to be talking about the glenohumeral joint, and specifically we're going to be performing an inferior glide of the glenohumeral joint. So first, let's just talk about the arthrokinematics. So you have a convex humeral head on a concave glenoid fossa. When you move into abduction, you're going to have a superior roll and an inferior slide or glide. And as you keep moving into that motion, it's going to continue to follow that same direction. So you're going to roll superior, glide or slide inferior. So in order to increase abduction, according to Dutton, it would make sense that you would want to perform a glide going inferior while the person is in an abducted position. So now we're actually going to perform the inferior glide of the glenohumeral joint. So for my patient, I'm going to assume that I've already assessed her range of motion, I've assessed joint play, joint mobility and stability, and I found a restriction in shoulder abduction at a certain range. And so for this technique, I'm going to use a grade 3 mobilization on the Maitland scale. For the purposes of this video, you could use any grade that you would want to, depending on what you're trying to address. Since I'm trying to address an increase in motion, I'm going to go for a more higher grade mobilization to actually cause that to happen rather than just pain relief, which would be for the lower grades. So I'm going to take my patient's arm and I'm going to move her to where I feel the restriction in motion. And let's say it's here at about 110 degrees of shoulder abduction. And so I'm going to place my hand as close as I can to the joint line. And then I'm going to provide slight distraction. And then I'm going to be pushing inferiorly, and it's going to be parallel to the treatment plane. And so for a grade 3, and I'm just going to lean my body into it. For a grade 3, I'm going to go take up some of the resistance in the tissue and then provide a long amplitude oscillation within that range. And again, this would be more to work on a stiffer shoulder rather than just pain relief. So now I'm going to perform this technique like I would as if I had a patient in front of me. So Kim, I hear you're having some shoulder pain, so I just want to look at your range of motion. If you could just bring your arms up over your head. Having some pain on that side? Mm-hmm. Okay. So what I'm going to do is a technique that's going to kind of help that motion occur more smoothly. So in your shoulder, your bones kind of have to slide down. They can't just hinge, otherwise we look really funny. So this technique is just to help improve some of that sliding motion to see if I can get that range back. Okay. So if you'll lay down on your back. All right. I just want you to try and relax that arm for me. Let me know when I get to that point where it's kind of right around here. Mm-hmm. Okay, so you can just relax for me. And I would do that technique for as long as I felt like I needed to get the range back for video purposes. I'm not going to do that. So then, Kim, can you set on up for me? And so I just want to see if that improved your range of motion. So can you lift your arms up over your head? All right, good.